treatment. Hospital will not stop the treatment. Upadhyay, Dallas Average Lions Club. Whatever I'm going to talk today here is only for information purposes. I would not recommend you go home and make changes in your treatment or your planning with your next visit with the doctors. Please go ahead and consult that with your healthcare provider if you have to do so. Now, this is the question we all have. What is cancer? Why cancer? Does anybody know what is cancer? What happens when you have cancer? Simple. Anyone? We have some prizes. Anyone knows? What causes cancer in the body? Sorry? Oh, beautiful. Thank you. Very nice. So there are a lot of questions when somebody is attacked with a diagnosis of cancer. What is cancer? Cancer occurs in the body. Our body is built of cells. They are basic units in our body. These cells are supposed to grow, multiply, do their job, aged, malfunction, and damage and die, right? That is a normal function. But what happens in cancer, those cells, even if they are immature, even if they are damaged and they are aged, they don't die. They just multiply, multiply, multiply. In a simple term, somebody said that we don't know what is cancer. So imagine a little cell starts growing, the other cell starts growing, and they start growing. And there will be a point when they say, we can't grow anymore, stop. And the other cell says, stop. Normal body, cells growth stops. But in case of cancer, the cells multiply, multiply, and even if they don't have any space, they overlap and go to the surrounding organs, tissues, and damage the whole system. That is cancer. Now, different kind of cancers, because we are short of time, there are 4 main ones that I'm going to discuss. Carcinoma. It begins in skin and tissues that lies the internal organ in your body, such as lung cancer, prostate cancer, colorectal cancer, breast cancers. Those are carcinomas. They're also called solid cancers. Solid cancers. Next one is sarcomas. It grows in tissues that supports your body. So, we need our body to be supported by fat cells, tendon, nerves, muscles, bone. If it gets attacked, it's called sarcoma, when there is cancer in those areas. The treatment, hospital will not stop the treatment. Upadhyay, Dallas Average Lions Club. When a diagnosis is made and given to the family, I used to be a gyn oncology floor oncologist at Parkland Hospital. It was a job that was assigned to me. Somebody comes in with a brand new diagnosis of cancer, you're gonna go ahead and take the intake and talk to them. So I would go in and sit down, hold their hand, and ask them if there is something they want to discuss. First listen to them and then find out. What I found out from 2 years of my staying there as an oncologist, hospitalist, that they started out with the guilt that they must have had a very bad lifestyle. They did not follow the advice of their doctor. They did not eat healthy. They drank too much, or they just didn't pay attention to 5 pillars of life. So they go through a guilt. Then I see them that they get angry. Okay, why do I have to go through this? There are so many people who have done the same thing that I did, are 100% normal. Why do I have to suffer this? How come she doesn't have this, or how come he doesn't have this? So there is some anger that goes on. And then there is a confusion because they'll have to go through different kind of modalities to see if they're going to fit into chemotherapy, radiation therapy, or they have to get through some immunotherapy. So they're confused. So there are a lot of mixture, hodgepodge going on. So I think psychosocial impact, we have to be a good listener to them. I think I didn't do much as a hospitalist. I just sat down, listened to them. Whatever I could relay, I did. But most of the time, just listening to them calmed them down. So my request to the community, if you find out somebody dealing with this cancer or a family is battling all those ups and downs in their family because they have a child with cancer, just give a listening ear. You have done your job. You don't even have to give them an advice. Just listen to them. That will calm them down. And I would also recommend that they follow through some psychosocial support, like they are life specialists that are just designed to help a family get through cancer. So if you don't know how to go through your psychosocial tribulations, please have that family connect with the life specialist and just be there for them. Same request with the parents also. Whatever is going on in their family, 85-95% time the child is going to make it. Always don't give up. Stay tuned till the end. Follow the doctor's advice. The child is going to get better. So that's what the treatment. Hospital will not stop the treatment. Upadhyay, Dallas Average Lions Club.